It is no great secret that our country today faces many enormously difficult problems. We remain in the midst of a very serious recession. Real unemployment is at about 15%. Our middle class continues to decline. The gap between the very, very rich, everybody else, is growing wider. 50 million Americans have no health insurance. Millions of young people are struggling, trying to figure out how they're going to make it into college and pay for their college education. But in the midst of all of those problems, I hope very much that we do not forget about the problems facing one of the most vulnerable sectors of our society, and that is senior citizens. We are an aging population. That's no secret. Today and every day, some 10,000 Americans reach the age of 65. And if we as a nation do not begin to address the very serious reality of an aging population, we are going to be in a lot of trouble that we are not anticipating. And one of the issues that we have got to understand is that not only are we an aging population, but many of those people who are becoming 65 and older are dealing with issues of poverty. Incredibly enough, 20% of the seniors in this country are living on incomes, an average income of $7,500 per year. $7,500 per year average income for the bottom 20% of seniors in this country. And frighteningly and embarrassingly, more and more seniors in this country are literally going hungry. Today, there are almost 1 million seniors who go hungry and many, many more who face the threat of hunger. That should not be happening in the United States of America. What America is supposed to be about is that when you age, you can live out your remaining years with security and dignity, not trying to find food in order to stay alive. Now, that's the bad news. The good news is that we have federal legislation called the Older American Act, which to some degree begins to address these very, very serious problems. And I'm happy to announce today that as the chairman of the subcommittee on primary health care and aging, we will be introducing legislation to reauthorize and improve the Older Americans Act. Madam President, the legislation that we are offering is going to do its very best to say that senior citizens in this country will not go hungry. This legislation is going to significantly increase funding for senior centers all over this country to provide congregate meal programs in senior centers. In my view, these congregate meal programs are enormously important, not only because they provide good nutrition to seniors all over our nation, but also they allow seniors to come together, to socialize, to talk to each other, to get some of the professional help that they need in their waning years. So we've got to strengthen the congregate meal program, and that's what this bill does. In addition to that, there is another program which is almost life and death to some of the most fragile and vulnerable people in this country, and that is the Meals on Wheels program. And what Meals on Wheels is about, takes place all over this country, is you have people in senior centers and in other institutions who take meals, a good quality, nutritious, hot meal to seniors, sometimes living at the end of a dirt road in Vermont or in Utah or in New Hampshire. These are people who cannot leave their homes, especially in the wintertime. These are people who in some cases would not survive if they did not have that Meals on Wheels program. And I want to take this opportunity to thank the many, many volunteers from senior centers and other institutions who get in their cars and in their trucks to take these hot meals to seniors all over this country through the Meals on Wheels program. What we are finding in my state of Vermont and what we are finding around the country is that many senior centers simply do not have the resources now to accommodate the growing number of seniors who need the Meals on Wheels program. And let me further say to any of my friends who say, well, Senator Sanders, this is a good idea, it's going to cost money. Yeah, it will. To increase funding for Meals on Wheels and congregate meals will cost additional revenue. But at the end of the day, the federal government will save money. We've had hearings on this issue. We've had physicians come forward, and they say that one of the reasons that seniors end up in the hospital, seniors end up in the emergency room, is because they are malnourished. Because sometimes, literally, because of poor nourishment, they fall, break their hips at great expense to Medicaid or Medicare. So not only is it the right and moral thing to do to keep seniors in this country from going hungry, in the long run, we save money by keeping them healthy. Furthermore, Madam President, I want in this bill, we are going to do something that I think is long overdue. There has been a lot of discussion here in the Senate and the House about Social Security. And some of my friends, often Republicans, sometimes Democrats, think that we should cut Social Security, that we should try to move toward a balanced budget by cutting funding for some of the most vulnerable people in this country. I strongly oppose that. And one of the arguments brought forth to cut Social Security as well, the COLA, the Consumer Price Index for the elderly, how we determine what the COLA is, it's too generous. It's really inadequate. Now, when I tell that to senior citizens in Vermont, do you know what they do? They laugh. They literally laugh when I tell them there are people in Washington, D.C., who believe that the formulation as to how we determine COLAs is too generous. And they say, Bernie, we haven't gotten a COLA for the last 2 years, so how is this too generous? And they are, of course, right. The way we, in my view, formulate the COLA right now is inadequate, not because it is too generous, but quite the contrary. The truth of the matter is that seniors' purchasing needs are different than the general populations. Everybody knows that. Seniors spend a higher percentage of their income on prescription drugs. They spend it on health care. In cold weather states like mine in New Hampshire, they spend it on keeping warm. Senior citizens are not out there, by and large, buying flat-screen TVs or laptop computers or iPhones or iPads. Their money is going into health care. And what has been happening in recent years, while the cost of some products, electronics in general, has been going down, the cost of prescription drugs and health care has been going up. So when you tell seniors that their COLA is too generous, they tell you that that makes no sense at all because they're spending more and more on health care, prescription drugs, staying warm in the wintertime. So what we have done in this bill is requested that the Bureau of Labor Statistics improve the Consumer Price Index for the elderly, or CPIE, by including more of the items that seniors spend money on, like prescription drugs and other health care costs. We must have a more accurate measure for COLAs for seniors, and I believe this is the path to a fair COLA. Madam President, I look forward to working with all of the members of the Senate to make sure that we do right by our parents and our grandparents, that we make sure that seniors in this country can live out their remaining years in security and in dignity by reauthorizing a strong and fair Older Americans Act in the coming months. And I especially want to applaud Senators Cole, Mikulski, Casey, and Franken for introducing other thoughtful, innovative, and important Older American Act amendments. Madam President, we're in a critical moment in American history, and in the midst of all of the other challenges that we face, let us not turn our backs on those who sacrificed, who fought the wars, who built the economies that made this country great. Let us support a strengthened and improved Older Americans Act.